Here's something most people don't realize. Personal hygiene isn't just about looking good or smelling fresh, especially as we get older. In fact, doctors can often tell, within just a few minutes of seeing a patient, whether something simple like brushing habits, shower routines, or even hand washing is quietly harming their health. You see, as we age, our bodies change. Our skin becomes thinner, our immune systems slow down, and our sense of smell or touch may weaken. What used to be a harmless habit in our younger years can now lead to serious issues like infections, skin breakdown, or even chronic conditions that go unnoticed until it's too late. That's why in today's video, we're uncovering 7 personal hygiene mistakes that older adults often make, and doctors notice right away. These are subtle, everyday habits that might seem harmless, but they carry serious health risks. And most importantly, we won't just point them out. We'll also give you simple, practical solutions that you can start using today to stay safe, clean, and confident as you age. So don't go anywhere, because what you learn in the next few minutes could make a huge difference in your well-being or that of a loved one. Let's dive in. 1. Skipping daily oral care. Let's begin with one of the most overlooked yet critical aspects of senior health: oral hygiene. For many older adults, brushing and flossing daily becomes more difficult over time. Conditions like arthritis can make it painful to grip a toothbrush or dental floss. Memory issues or cognitive decline may cause someone to forget to brush regularly. And let's be honest, if you wear dentures, it might feel like brushing isn't as necessary anymore. But here's the truth. Doctors and dentists can spot poor oral hygiene within seconds. They look for signs like plaque buildup, inflamed or bleeding gums, bad breath, or even dry mouth, all of which can signal deeper health concerns. Why does this matter so much? Because poor oral hygiene isn't just a cosmetic issue, it's a serious health risk. Studies show that gum disease has been linked to heart disease, diabetes, respiratory infections, and even pneumonia in seniors. Harmful bacteria in the mouth can travel through the bloodstream, affecting major organs and weakening the immune system. And for those with dentures, poor care can lead to oral thrush, gum sores, and infections that can affect eating, speaking, and overall quality of life. Here's how to fix it. Switch to an electric toothbrush. These are easier to grip and do most of the work for you. Look for models with larger handles and pressure sensors. Use soft bristle heads to avoid irritating sensitive gums. Flossing is still important, even if it's tricky. Consider using floss holders, water flossers, or interdental brushes made for limited hand mobility. Stay consistent. Brush at least twice a day and floss once. Dentures? Clean them daily with a soft denture brush and soak them overnight. And don't forget, you still need to clean your gums and tongue. Finally, visit your dentist every 6 months, even if you have no natural teeth left. Dentists check for early signs of infections, oral cancer, and other hidden issues. Taking care of your mouth is taking care of your entire body. It's not just about fresh breath, it's about staying healthy, confident, and preventing bigger health problems down the road. 2. Not bathing. Often enough. Now let's talk about something that's more common and more serious than most people realize: not bathing often enough. For older adults, skipping a shower here and there might seem harmless. After all, if you're not sweating much, what's the harm in going a few extra days? But here's what doctors know. When personal hygiene becomes irregular, the signs show up fast, and they're not just cosmetic. They notice things like body odor that lingers, dry or flaky skin that hasn't been washed or moisturized, or even more concerning issues like fungal infections, rashes, or pressure sores. These may seem like small issues at first, but left unchecked, they can become serious health concerns. For instance, fungal infections under skin folds or in areas like the feet and groin can spread and lead to more severe complications if the immune system is weakened. So why do many seniors skip regular bathing? Well, there are very valid reasons. Fear of falling in the shower is one of the biggest. Some seniors feel cold more easily, and stepping into a damp, chilly bathroom can be deeply uncomfortable. Others may struggle with mobility issues or even feel too tired or forgetful to keep up the routine. But the key is this: bathing isn't optional. It's essential for keeping the skin clean, reducing infection risk, and supporting overall well-being. Here's how to make bathing safer, more comfortable, and more consistent. Aim for 2 to 3 full showers per week, depending on skin condition and activity level. On non-shower days, consider doing a gentle sponge bath with a warm washcloth, focusing on high-risk areas like underarms, groin, and feet. Safety first. Equip the bathroom with non-slip mats, grab bars, and a sturdy shower chair to reduce the risk of falling. Keep the room warm. A small space heater or warm towels can make the experience far more comfortable. Use mild, fragrance-free soaps to prevent skin dryness, and always moisturize afterward to keep aging skin healthy and hydrated. And if someone is hesitant or struggling to bathe on their own, don't be afraid to ask for help. A caregiver, family member, or professional aid can help make hygiene feel less stressful and more dignified. Staying clean isn't just about appearance, it's about comfort, confidence, and protecting your health from the ground up. 3. Overusing scented soaps. Let's talk about something that smells nice, but might not be so nice for your skin. We're talking about scented soaps and body washes. Now, who doesn't love a nice lavender or citrus scent in the shower, right? It can feel refreshing, even luxurious. But here's what doctors see all too often, especially in older adults: dry, flaky skin, itchy rashes, and even allergic reactions, all caused by soaps and products that are too harsh for aging skin. Here's why this happens. As we age, our skin becomes thinner, drier, and more sensitive. It doesn't retain moisture like it used to, and the natural protective barrier that keeps out irritants starts to weaken. Harsh chemicals in fragranced products, dyes, and strong detergents can strip away the skin's natural oils, leading to redness, inflammation, and irritation. For some, this may cause discomfort. For others, it can lead to cracks in the skin, which opens the door to infections, especially dangerous for those with diabetes or compromised immune systems. So, what's the fix? It's simple but powerful. Switch to fragrance-free, gentle cleansers designed specifically for sensitive skin. Look for labels that say dermatologist tested, hypoallergenic, or for sensitive skin. These products are typically free of dyes, alcohols, and synthetic perfumes that cause irritation. Avoid products that list fragrance or parfum high on the ingredient list. These are red flags. And after bathing, always follow up with a moisturizer that's fragrance-free as well. Apply it while your skin is still slightly damp to lock in hydration. Bonus tip: some natural products, like oatmeal-based cleansers or aloe vera washes, can be soothing and safe options. But even with natural products, always do a patch test first. Bottom line: just because something smells good doesn't mean it's good for you, especially when it comes to aging skin. Less is more. Less fragrance, less irritation, and much more comfort and protection. 4. Ignoring foot care. Here's a personal hygiene mistake that often flies under the radar until it causes real problems: ignoring foot care. It may surprise you to know that one of the first things geriatricians look at during a physical exam is the feet. Why? Because feet can reveal a lot about your overall health, especially in older adults. Doctors often check for circulation problems, like cold toes or slow-healing wounds, fungal infections, such as athlete's foot or thick, discolored toenails, or early signs of diabetes complications, like nerve damage, numbness, or skin ulcers. Unfortunately, many seniors neglect daily foot hygiene. Maybe it's hard to bend down, maybe it doesn't seem urgent, but the consequences can be serious. Even a small blister or callus can turn into a dangerous infection if it's ignored, especially for those with diabetes or poor circulation. So how can you take better care of your feet? Here's what doctors recommend. Wash your feet every day with warm, not hot water and a mild, fragrance-free soap. Dry them thoroughly, especially between the toes. This helps prevent fungal infections. After washing, inspect your feet carefully. Look for any Blisters, redness, swelling cracks, or unusual discoloration. If something seems off, don't wait. Have it checked. Moisturize daily, but avoid putting lotion between the toes, as that area needs to stay dry. Trim toenails regularly, but be careful. Cut them straight across to avoid ingrown nails. If you can't trim them safely yourself, a visit to a podiatrist is well worth it. And make sure you're wearing comfortable, breathable shoes with good support. Avoid tight shoes or non-ventilated materials that trap moisture. Your feet carry you through life, literally. Taking a few minutes each day to care for them can prevent pain, infections, and long-term health problems. And for many seniors, healthy feet mean more independence and mobility. 5. Poor incontinence management. This next topic may feel a bit uncomfortable to talk about, but it's one of the most important when it comes to hygiene and overall health, managing incontinence. The truth is, many older adults experience some level of bladder or bowel control issues. It's common, and it's nothing to be ashamed of. But when incontinence isn't managed properly, the consequences can be serious, and doctors notice them right away. They can often detect a lingering ammonia-like odor, red or irritated skin in the lower body, or repeated urinary tract infections, all signs that the skin isn't being cleaned or protected properly. When moisture is trapped against the skin for long periods, especially from urine or feces, it creates the perfect environment for bacteria and skin breakdown. Over time, this can lead to painful rashes, pressure sores, fungal infections, or worse, especially for those who are immobile or bedridden. So how can this be handled with dignity and good health in mind? Here's how. Use high-quality absorbent pads or briefs that are specifically designed for older adults, not just generic products. These are more breathable, more absorbent, and better at keeping moisture away from the skin. Change them regularly. Don't wait until they're soaked. Frequent changes prevent irritation and odor. After each use, gently cleanse the area with mild, fragrance-free wipes or a soft washcloth and warm water. Pat the skin dry, never rub. Apply a barrier cream or ointment, something like zinc oxide or petroleum jelly. This creates a protective layer between the skin and moisture, reducing the risk of irritation and infection. If incontinence becomes frequent or severe, talk to your doctor. There may be underlying causes that can be treated or managed through diet, medication, or pelvic floor exercises. And for caregivers, handling incontinence with patience, compassion, and routine can make a world of difference in someone's confidence and well-being. Bottom line, incontinence isn't something to hide or ignore. It's something to manage with care, comfort, and the right tools, because preserving skin health and dignity go hand in hand. 6. Not washing hands properly. Here's one that seems incredibly simple, but can have serious consequences. Not washing your hands properly. You might think, I've been washing my hands my whole life. What's the big deal? But studies consistently show that most people don't wash their hands long enough, often enough, or thoroughly enough. And doctors? They can trace everything from stomach bugs to respiratory infections back to this one small habit. In older adults, the risks are even greater. Why? Because our immune systems weaken with age, making it easier to catch illnesses and harder to fight them off. Even something minor like a cold or a stomach virus can lead to complications, dehydration, or hospital visits in seniors. So, when doctors see someone with frequent infections, irritated skin, or gastrointestinal issues, one of the first things they ask is, are you washing your hands the right way and at the right times? Here's how to fix it the right way. Always wash your hands with soap and warm water for at least 20 seconds. A good trick? Sing Happy Birthday twice in your head. That's just about the right length of time. Focus on all parts of your hands, the palms, backs, between the fingers, and under the nails. Dry thoroughly with a clean towel or paper towel. Damp hands can still carry germs. Be especially mindful to wash before eating or preparing food, after using the bathroom, after coughing, sneezing, or blowing your nose, after touching pets, handling garbage, or returning from public spaces. When soap and water aren't available, hand sanitizer is a great backup. Just make sure it contains at least 60% alcohol, but don't overdo it with sanitizer. Overuse can dry out your skin, causing cracks that actually make it easier for germs to get in. So, moisturize regularly, especially in the winter or dry climates. This tiny habit, done right, can help prevent countless illnesses, especially in older adults. It's one of the simplest, cheapest, and most effective health tools we have. So remember, clean hands protect everything you care about: your health, your independence, and the people around you. 7. Neglecting hair and scalp. Hygiene. Last but certainly not least, let's talk about something that's often overlooked, but doctors notice it right away: neglecting hair and scalp hygiene. As we age, it's easy to let hair washing slide. Some seniors skip it because of mobility issues. Others simply forget, especially if they're dealing with memory loss or depression. But just like your skin and teeth, your scalp needs regular care to stay healthy. When hair isn't washed regularly, several things start to happen. Oil, sweat, and skin cells build up on the scalp. This can lead to itching, dandruff, and even bacterial or fungal infections. In more serious cases, buildup can clog hair follicles, potentially leading to hair loss or scalp inflammation. Doctors often spot signs like greasy hair, irritated scalp, or unpleasant odors that patients themselves may not even notice. And for seniors, these symptoms can also be linked to other health concerns, like dehydration, poor nutrition, or hygiene neglect. Here's how to take care of your hair and scalp without stress. Aim to wash your hair once or twice a week, depending on your hair type and activity level. Use a gentle, moisturizing shampoo, especially if your scalp tends to be dry or sensitive. Avoid strong fragrances or formulas meant for oily hair unless your doctor recommends them. If a full shower is difficult, try using a shampoo cap, no rinse shampoo, or dry shampoo in between washings. These products can freshen your hair and scalp without needing to get fully wet. If washing becomes physically challenging, consider visiting a mobile salon service or having a family member or caregiver help. Many hairdressers even specialize in senior or homebound care. Don't forget to brush gently to stimulate the scalp and remove loose skin flakes and hair. Clean, healthy hair isn't just about looks, it's about comfort, hygiene, and confidence. Taking a little time each week to care for your scalp can help prevent irritation and infections and leave you feeling refreshed and put together. So whether it's with a full wash, a dry shampoo, or a helping hand, make hair care part of your hygiene routine. Let's bring it all together. Personal hygiene is about so much more than just staying clean or looking nice. It's a powerful part of aging with dignity, comfort, and good health. And while these 7 hygiene mistakes might seem minor on the surface, over time they can lead to serious health problems, from infections and skin issues to preventable hospital visits. But here's the good news. Every one of these mistakes is completely fixable. Whether it's brushing your teeth more thoroughly, switching to gentler soap, or asking for help with washing your hair, small changes really do make a big difference. And it's not just about hygiene, it's about preserving your independence, confidence, and overall well-being. These little daily habits are the foundation for a safer, healthier life as you age. So whether you're a senior looking to stay strong and independent, or you're a caregiver supporting someone you love, let this be a gentle reminder. Make hygiene a priority, because your health is worth it. If you found this video helpful, please take a second to give it a like. Share it with someone who could use these tips and subscribe for more practical advice on healthy aging, safety, and living your best life at any stage. Aging is a journey, and you deserve to feel good every step of the way. Thanks for watching, and take care of yourself. You've earned it.